Hi, I'm Taylor McFarland. I'm a board-certified pediatric dentist practicing in the Eastern United States, and I'm a mom of 3. Believe it or not, in my household, each one of my 3 children has gone through a period of time where it was difficult to brush their teeth, and I'm a pediatric dentist. I know all the things to do, right? And my 18-month-old is actually going through that right now. So please hear me that you are not a bad parent and you are not alone. Your child is not terrible. If they're struggling with toothbrushing, it's really common. Children are dynamic, they are their own people, and sometimes what worked yesterday may not work today. So we have to be creative and come up with different ways to try to meet that need for our child, to give them a healthy mouth, clean teeth, but to do it in a way that can be fun and is not traumatic. Oral aversion to toothbrushing, to flavors, to sensations is not uncommon amongst children or adults. Your child is not strange. Developing that skill, both for you as a parent and caregiver and for your child, takes time. So I'd consider this your toothbrushing boot camp. Give yourself about 2 weeks working toward this goal of morning and nighttime toothbrushing with your child. Allow yourself a scaffolding period where you're building the foundation of a positive relationship with toothbrushing that you may not quite be brushing the full length of time that you need to, but by the end of 2 weeks, our goal is to be there. First, I'll start by saying that one of the keys to success with toothbrushing is introducing it early. So if your child is not yet struggling with toothbrushing, you were just searching for when do I start brushing my baby's teeth, this is the video for you. It's now. It's actually before they even have teeth. For each of my children, I actually started cleaning their teeth with a washcloth at bath time. I just wrapped it around my finger, got it a little bit wet. You don't need soap, you don't need toothpaste. Before their teeth have arrived, you're just wiping their gums, their cheeks, and their tongue off to get them used to you cleaning their mouth at bath time. Then once they get teeth, it's very easy to introduce a bristled toothbrush, so you don't want to use those silicone trainer toothbrushes, the finger toothbrushes. I love the Oral-B 0 to 24 month Winnie the Pooh toothbrushes. I also like, as they get molars, a triple-sided toothbrush that helps you get in and out quickly and clean all 3 sides of the teeth. Early introduction to mouth care when your child is an infant also paves the way for the American Academy of Pediatric Dentistry's recommended age 1 dental visit. The dental home policy put in place by the AAPD about 20 years ago recommends that every child have a dental home established by their first birthday. If you're wondering when your child should first see the dentist, it is by their first birthday or within 6 months of their first tooth coming in, whichever is earlier. Don't hesitate to ask at your child's dentist visit for tips. Ask them to talk to your child about toothbrushing and the importance of it, why it's good for their teeth and for their body, and then ask them to show you positioning, different things that might help make it easier for you. So let's say you've waited to introduce toothbrushing. Your child's a little bit older, maybe they're 2. You haven't sort of established this foundation of mouth care from the beginning, and so it's weird sensations, weird taste, and the child doesn't like it. How do we build a relationship with that child and oral care that is positive? One trick is to bring in positive associations from elsewhere. Introduce things that they like. So tablet with a show that they love, a song that they love, find an app. The Disney toothbrushing app from Crest is really good. Pokemon Smile can be fun for a little bit older child. And then there are toothbrushes like Hum from Colgate that has an app that they can brush with and see kind of the teeth as they're going along that they're cleaning. That can help too. Try first for consistency and predictability. Have it be the same person. Have it be the same time of day. Children like watching the same show over and over and over because they know what's going to happen. They know how it's going to end. So use the same verbiage about toothbrushing. Let them know when it's going to happen. So talk about it beforehand. All right, we're going to brush your teeth in the bathtub tonight. I know. So validate their feelings. Acknowledge that they may not like it. Acknowledge that sometimes you and other adults and other people don't like toothbrushing. So validating is important. And then just talk through that experience. Let them know what's going to happen. Let's know who's going to be there when, and then let them be involved in some of the decisions. What toothbrush are we going to use? What flavor toothpaste are we going to use? Are you going to brush your teeth first or am I? And that's another tip snuck in right there, is let them have a turn. We do want to be very careful with toothbrushing that you do not let the child be unsupported or unsupervised with the toothbrush, because I'll put up a kind of scary picture here. The brainstem is right in the back of the throat. There's very little tissue between the back of the throat and the brainstem, and many a child has had a horrid injury from falling on their toothbrush. So let them have a turn with the toothbrush, but it does need to be always supported near you, preferably not standing up, definitely not walking or running around with their toothbrush. But let them have a turn with the toothbrush, and then you have a turn also. You're the one that afterward or before does a thorough cleaning. So these are some choices you can give them. What toothbrush? Where do you want to brush? They can choose where. Would they rather lay on the floor? Would they rather sit in the bathtub? Would they rather sit in mom's lap? Would they rather sit in the sink? Would they rather sit in their high chair? Let them have some say, and sometimes just that problem solving alone, if it's a little bit older child, can really help. Another tip or trick that helps is something called behavior modeling. This is when the behavior that you want to see accomplished is modeled for that child first. You can model within a family. 2 caregivers can model this. Other siblings can model this in real life, of turn taking with toothbrushing, letting the person brush their teeth themselves and then having the other person come after and check and do that final cleaning. So turn taking with toothbrushing is an important aspect to teach. Toothbrushing, if we're honest, is just kind of a strange thing. So just acclimating them to it, letting them see what it looks like for someone else can often help. But let's say you've been trying for a little while, you're in maybe the first week of that toothbrushing boot camp of the 2 weeks, and you've been doing the knee to knee position, the two adults, you got someone that can help you. And so one adult is holding the child's hands, the other adult has their head resting in their lap. I'll show you an image of what this looks like. You guys have been brushing, and that second adult is calm and encouraging. You're doing so great. I know you don't like toothbrushing. We're almost done. Let's count to 10. Let's sing a song. Let's tell a story. They're doing all of these things to try to make it positive, and that child is still screaming the whole time you're brushing, and you're like, man, this stinks. Is this the rest of our life? Is this what it's going to be like? No. Well, let's try flipping our attitude, not from like calm and encouraging and you're safe and I love you, but to fun and novelty. And this was the key with my 18-month-old. What we ended up doing was making it silly and making it a game. What we do to try to make it fun is I will sing a song, I will tell a story, but we will pretend that I'm a robot or I'm a dinosaur brushing teeth. Favorite thing to do is try to whack my ponytail, to whack my head with feet, and then I pretend like I'm trying to bite feet. So we're being silly. After you get used to brushing, you will get pretty efficient at not even really needing to look, but knowing where you are in brushing, and you can kind of play around. You can also work with loveys, so take their favorite stuffed animal and have them practice through pretend play how to brush teeth. And you can talk through the routine with that lovey, and they can be right there along with them if you want to. They can brush their teeth alongside them just like they brushed their teeth earlier in the day. So pretend play can help. Positioning is really key, that you want good head control of that child, and that does not mean you necessarily have to lay the child on the floor where you're blocking their arms. Some children will just lean back against your chest, against your tummy, against your armpit, and allow you to brush. That was my for the longest time. I didn't resist toothbrushing until more recently, about 18 months. And I hesitate to say I was even resisting, just kind of bored of it. And just wanting to wiggle around and move. And for safety, we need to restrain so that he doesn't fall, doesn't hurt our toothbrush, and so that I can do a good job brushing. But try different places with brushing and see if maybe one that worked before and it's not anymore, now a new place will. The bathtub is my favorite place to brush, and it seems kind of weird, but I love it. The high chair is another place you can brush. Sitting in their rocking chair where they read books, you can sit on the floor, they can lay in your lap. And then another popular one is in front of a mirror with them standing on a stool or sitting in the sink and you supporting behind. They can look at everything that's happening because what they feel in their mouth is weird, and being able to see it sometimes helps them. There are also a lot of wonderful resources, books, I'll link some of them in my shop about toothbrushing that can help acclimate a child to that process. But you know the good news? You don't have to brush their teeth for 2 minutes. It's about 5 seconds per each tooth that they have. So if your child only has 4 teeth, you really only need to be brushing about 20 seconds. And when parents learn that, that is often freeing. So let's say you found this video and you have an 18-month-old and they have 16 teeth. So if we're looking at our goal, what are we working toward in terms of brush time? 5 seconds times 16 is 80 seconds. So like almost a minute and a half, but not quite. How do you build up over a 2-week period to that minute and a half? Because right now that sounds like forever. We are looking for that amount of time because we want to clean the fronts, the backs, and the biting surfaces. If you're really struggling, this can help you in that scaffolding phase, a triple-sided toothbrush to clean all 3 sides of the tooth efficiently so that even if you're not quite to the 80-second mark, you're still getting all surfaces relatively clean. If your child is really resistant to toothbrushing, your first day of this 2-week period may just look like them deciding what color toothbrush and what flavor toothpaste they want, putting a little bit on the toothbrush, and then modeling with you how to brush, playing with you and how to brush, and then maybe a few seconds of touching it to their cheek, to their nose, to their hair. Should we brush your hair with your toothbrush? No, we should brush your teeth. Let's see, what's that like? And you just do the front teeth, and it's 10 seconds. And that's okay for a period of time. That's why I say 2 weeks. Give yourself 2 weeks to build up confidence. Don't stress that you haven't cleaned them. You're not going to develop cavities in 2 weeks. You can over 2 months, 6 months, a year. This isn't our forever, but it is a 2-week scaffolding period we're going to allow to build trust and confidence regarding toothbrushing. Over time, each night, aim for a little bit more. I do want to note that if you have a child that suddenly flips on you, they've been a great brusher and suddenly they seem fearful or afraid, you may have brushed across an area that was sensitive in their mouth and suddenly they were like, oh no, this can hurt. No thanks, I'm out. So be sure you're watching for the maxillary frenum. It's this piece of tissue up here. I'll put a little picture on the screen. Often when you brush side to side in their mouth, you can scratch across with the bristles that area, and it is sensitive and it can make many a child resistant to toothbrushing. Those frinae are very prominent when the child is young. Many mommy groups love to say, oh, they have a lip tie, and that's just, it's not a lip tie, okay? It is just a maxillary frenum. It's normal anatomy, and with time, relatively, that moves up, the teeth move down. So it's nothing to worry about there regarding a lip tie, but it can make brushing sometimes a little difficult, especially in the beginning. What I do is I put my finger there and I lift it up over that frenum so that I'm still getting the whole tooth, and then I brush up and down rather than side to side, and that can help prevent sensitivity in that way. So if you have questions as you are starting your 2-week toothbrushing bootcamp journey, ask away in the comments and I'm going to come and try to give some feedback for you guys. Let me reiterate again, if you are struggling, your child is neurotypical, typically a 2-week period, kind of building up to brushing for that full length of time will get a child more comfortable with brushing. That is our goal. It's not to have a perfect child that stands there like a statue and smiles as we brush their teeth, but that they have a positive perception of toothbrushing and that you do too as an adult. This is a big part of our daily routines. We don't want it to be absolutely miserable with our kids, right? So we're trying to find a way to make it positive. If after 2 weeks you've done all of these tips and tricks and it is still a struggle, do not hesitate to reach out to your pediatrician and ask for a referral. Typically that's to a pediatric OT, an occupational therapist, but they can help with desensitization and give you even more one-on-one tips and tricks for you and your child about what will work. I hope these methods can help make toothbrushing go a little bit more easily in your home.